This video will demonstrate the appropriate electrical therapy techniques used to treat various cardiac dysrhythmias. We will discuss defibrillation, synchronized cardioversion, and transcutaneous pacing. The monitored defibrillator used in this video is for instructional purposes only. It will be the responsibility of the EMSP to learn the steps necessary to provide electrical therapy using the devices utilized by their service. Varying protocols and manufacturer recommendations dictate that the EMSP must understand the monitored defibrillator they will use. For specific questions, please refer to your medical director or training officer. All providers should ensure a safe and hazard-free environment while performing electrical therapies. We will begin with defibrillation of the cardiac arrest patient. Take appropriate body substance isolation. Ensure high-quality, minimally interrupted CPR is in progress. Apply monitor/defibrillator pads without interrupting CPR. It is recommended that application of the limb leads always be placed when applying hands-free defibrillation pads. At the appropriate time, stop CPR and observe rhythm. If rhythm is shockable, charge to the manufacturer's suggested setting or what has been implemented by your medical director. It is important for the EMSP to ensure compressions are continued while the monitor charges. Two main methods are utilized to reduce the time from last compression delivered to the shock application. Either pre-charging the monitor, stop compressions and apply the shock if necessary in a quick fashion, or stop compressions, identify a rhythm, and resume compressions during the charge cycle. The EMSP should also ensure that compressions are resumed after the shock has been applied. After desired energy has been reached and the defibrillator is ready, verbalize all clear and visually ensure no one is touching the patient.
Clear the head, clear the feet, all clear.
Depress the shock button to deliver the energy. Immediately resume compressions after energy has been delivered. Continue compression and defibrillation cycles based on current recommendations. Next, we will discuss proper techniques for the use of synchronized cardioversion. Maintain proper body substance isolation. Ensure appropriate oxygen therapy has been initiated along with vascular access. Perform assessment to include vital signs and history. Attach monitored defibrillator and verify rhythm appropriate for synchronized cardioversion. Again, ensure that both hands-free pads and limb leads are placed. Determine the need for sedation and inform the patient of the procedure. Activate synchronizer and ensure the monitor recognizes the QRS complex. Verbalize all clear and visually ensure no one is touching the patient.
Clear the head, clear the feet, all clear.
Press and hold the shock button. This button must be held down until the energy is delivered. Reassess the rhythm and patient after application of energy. Ensure patient is continually monitored and apply subsequent synchronized cardioversions as necessary. Finally, we will discuss the use of transcutaneous pacing for the bradycardic patient. Maintain appropriate body substance isolation. Ensure appropriate oxygen therapy has been initiated along with vascular access. Evaluate vital signs and patient history. Attach the monitor defibrillator and verify rhythm appropriate for transcutaneous pacing. Ensure both limb leads and hands-free pads are placed. Determine the need for sedation and inform the patient of the procedure. Activate pacemaker function. Set appropriate rate. We will be utilizing a rate of 80 pulses per minute. This device is a demand pacer that will only deliver electrical therapy when the heart rate falls below the set rate. Also, should the limb leads become detached, this pacemaker will deliver static pacing at the set rate regardless of the underlying heart rate. Begin increasing current starting at 0. Increase current incrementally until electrical capture is noted on the monitor. We will be increasing the current by 10 milliamps. After gaining electrical capture, ensure mechanical capture that corresponds with monitor waveform. Note minimum threshold and document accordingly. Reassess the patient, monitor electrical and mechanical capture, and assess need for continued sedation throughout the transport.